were the 8 people who visited more than 3 clinics actually interviewed for the reasons why they had gone to so many, as well as those the rest of the 30 people who had mentioned that they had gone to more than one? Was it a reason, were the reasons because they know that they had the COVID, they feel like they have the COVID infection, but that, like the GP would not diagnose them? And also, an additional question is that whether GPs are feeling supported enough during this period to be able to diagnose properly.
I'll ask the DMS to elaborate on them, but I would guess that many of them have different reasons why they have visited multiple clinics. Some may be because of convenience. They may have visited one near their workplace, then subsequently visited one that's near their home. And some may be the original clinic, he didn't see that he did not recover, and therefore he wanted to visit another clinic. So I would imagine that the reasons are quite varied. Maybe DMS can elaborate.
I don't have an opportunity to share with you some of the different reasons why patients might move from one doctor to another, and I'm sure as time goes on, some of these reasons would become more evident. But it's important to emphasize why we think it's important not to doctor hop. If you see more than one doctor, the doctors will not be able to appreciate how your illness has progressed, how it's getting worse over time, and this, in fact, may delay their ability, therefore, to suspect the presence of a COVID-19 infection, and that delays your diagnosis. At primary care level, in other words, in our primary care clinics, particularly our PHPCs, where our family physicians are, they are well-schooled and experienced to pick up clinical features that may suggest the presence of respiratory infection. And where they suspect, on the basis of their clinical examination, the presence of a pneumonia, they know that these are the patients that need to be referred into the hospital for further testing. At this time, the testing for COVID-19 infection is done in our hospitals, but the referral from the clinics is done on that basis of a clinical suspicion. If a patient who presents to them repeatedly after having been seen before, not getting better, or progressively getting worse, these in fact are red flag indicators for the doctors then to be particularly suspicious and to have a lower threshold for making a referral. And therefore that's also why it's important therefore not to doctor hop.
I should add that there could be valid reasons for multiple clinics, because the first clinic might be closed on weekend and you decided to see a different clinic because you are ill and not well, so there could be legitimate reasons. But whatever is the reason, if you need to see a different clinic, you must inform the clinic that you have seen a doctor before, so that the doctor that's seeing you knows the history and will be able to check back on the history and see how you were doing before, so that this history taking is very important if you were to see a different clinic as well.